Well, welcome back, VA Northern California. I'm David Stockwell, Medical Center Director, and it's time for my weekly video blog. You know, every day when I walk into work, one of the volunteers that sits at the front desk tells me what day it is that day. So today, when I came into work, she let me know that today is Bacon Day. Now, I'm not sure if you've already eaten lunch or you're planning lunch. By the time you watch the video, it won't be Bacon Day anymore. But coming up on August 31st is International Overdose Awareness Day. At VA Northern California, we believe that together we can reduce the risk of overdose and help save lives. Whether you're a veteran or a family member or a friend of a veteran, VA has resources to help. And to amplify this message today, I'm going to interview Carla Figuera, who is our harm reduction coordinator here at VA Northern California. So, hello, Carla. All right, so for the audience watching online, how long have you worked at the VA, and what is it that you do here at VA NorCal?
So I first started with VA as a resident in 2018, a little over 7 years ago, and I've been with VA Northern California since December of 2023. My role at our facility is called Harm Reduction Coordinator. And in this role, I provide both direct patient care to veterans with substance use disorders, as well as have dedicated time to expand the resources, supplies, and educational opportunities for both veterans and staff about harm reduction initiatives.
So the audience gets to know just a little bit about you. What can you tell us a little bit about yourself, professionally, personally, something interesting for the audience?
Sure. So I'm a pharmacist by training, and my residency training was in pain management and palliative care with a focus on opioid use disorders. So I became particularly interested in how pain management or a lack of access to pain management can contribute to somebody's use of non-prescribed substances or alcohol to cope with their physical or emotional pain that they're experiencing. And so in healthcare, our first priority is non-maleficence, or to do no harm. And so with this perspective, this is where my interest in harm reduction really began, ensuring that we are providing, the care that we're providing isn't inadvertently causing harm to our veterans. So when this role opened up here at VA Northern California, I was really excited for the opportunity to transition into this role, to do this harm reduction work full time. And it's such an honor to get to serve veterans in the way that I do. So for those who might not be familiar with what harm reduction means, it's simply taking an evidence-based approach to reduce the possible negative consequences of some activity or behavior that we're participating in. We all do this every day. We wear seatbelts when we drive in the car. We wear helmets on bikes and motorcycles. We put sunscreen on when we go to the beach. We wore masks during the pandemic. We put child safety caps on prescription bottles. The list goes on. We recognize that activities in our life have risk, but we either can't or aren't yet interested in avoiding that risky behavior. We don't deny the risks. On the contrary, we face them head on and we work to reduce the likelihood of them happening. And so this same mindset can be applied to our relationship with substances, whether that's alcohol, a prescription medication, or a non-prescribed substance. By no means is harm reduction encouraging substance use. We aim to provide a safe, non-judgmental space to have an open and honest conversation with veterans about their substance use, make sure that they're thoroughly educated on the risks of what they're doing, and offering evidence-based tools to reduce risks where we can, with a primary focus on reducing overdose deaths, as well as reducing long-term consequences of that use. When we provide this safe space for these discussions, not only do we provide education on risks they might not know otherwise about, but the data shows that they're then that much more likely to return for care when and if they're ready to change that behavior, whether that's to reduce their use or quit. We also recognize that substance use itself is not always the only risk that a veteran might be facing. Substance use can impact other areas of our lives like housing, mental health, sexual health, compliance with our chronic medications, nutrition, and so much more. And so we aim to address these other needs as well, even if it's not specifically related to reducing the substance use itself today.
Wow, such an important role in VA healthcare. And, with the focus on pain management and alternative methods for, addressing pain, just a perfect addition to our team. So glad to hear that. All right, so August 31st is coming. What is Overdose Awareness Day about?
So, International Overdose Awareness Day is recognized on August 31st every year. And the goal of the events that we're hosting is to bring people together and spread awareness about overdose prevention. Events are occurring all over the world. Some are focusing on education, like ours, others on remembrance of those that we've lost, and some cities will even light up their monuments purple in honor of the day. This year's theme for International Overdose Awareness Day is One Big Family Driven by Hope. And if folks are interested in learning more about this, they can find information at overdoseday.com.
Right, it almost sounds like light the beam with the highlighting the purple right there. All right, what is opioid overdose education and naloxone distribution program? So OEND is the acronym, but what can you tell the viewers about that?
The VA's OEND program aims to reduce life-threatening opioid overdoses and death amongst veterans. Of course, providing naloxone to veterans to respond to an opioid overdose is imperative, but equally as important is that overdose education component, the OE. We need to ensure that veterans and their caregivers know what the risk factors for an overdose is, how to identify that an overdose is recurring, and how to respond to that overdose if one is identified. The OEND program has multiple components. So this includes training and education for veterans, their caregivers, and staff, making naloxone as available as possible, and ensuring adequate overdose responses should one occur on campus. So in addition to the patient outreach that we do, our VA police also carry naloxone should they encounter an overdose in the line of duty. And you might have also noticed across the healthcare system some metal boxes that are being placed next to our AED cabinets. These will soon be overdose response kits, so staff have easy access to naloxone in our high-risk areas across the healthcare system should an overdose occur on VA property. And through this initiative, naloxone is available for free for veterans who may be at risk for opioid overdose. And there are some misconceptions about who this actually includes. So any veteran who is at risk to being exposed to an opioid in any form for any reason can receive a naloxone kit for free. This includes if they're taking prescription opioids, even if taking them as prescribed, because we know that there is no dose of opioids considered completely safe, those who use non-prescribed opioids recreationally, and those with an opioid use disorder. But it also includes people who might be exposed due to their current living arrangements. And in the age of fentanyl contaminating the majority of the illicit substance supply, anybody using any non-prescribed or illicitly manufactured substance of any kind should be offered this as well. And again, for any of these veterans, that would be completely free.
Yeah, that's super cool to hear about the boxes that are going to be up near the AEDs in the future. What are some of the other harm reduction resources the VA has available for veterans?
Oh goodness, we have tons, but some of the most frequently used ones include education opportunities on how to reduce harm with various substances, whether that's alcohol or other substances someone might be using. Education on medication safety and compliance aids, like an alarming medication organizer. We also have fentanyl testing supplies, safer sex education, STI screening and access to treatment if needed or vaccines to prevent them, or HIV prophylaxis for pre-exposure or PrEP, and as well as connection to housing resources. Substance use doesn't usually happen in a silo, and it can start to affect many areas of someone's life. And so even if their priority right now is not on reducing the substance use, but they want to improve other areas of their life and their well-being, that is still likely to reduce their overall risk of a negative outcome. And so we work to address those needs, and if we can't do it, to connect them with the right folks who can.
I love the wraparound services and the variety that we offer right there. If a veteran wanted to know how to get a hold of these resources, what would we want to tell them?
So we're here to support any veteran who wishes to be connected with any of the resources I've mentioned, but nothing that I mentioned is restricted to our team or are veterans required to see us to gain access to them. They can speak with their VA provider, and if needed, that provider can refer to us. Or veterans can contact us directly by calling the Harm Reduction Team phone line. That phone number is 916-843-6808. That phone number comes right to our team instead of having to call the main line and know which extension to dial. Of course, not for emergencies, using appropriate emergency resources in that case. like 911, the ED, or the crisis line. But to get connected with care, they can give us a call and we will call them back usually the same day, but at worst within a day or two to address their questions. In regard to naloxone specifically, there's a number of ways that veterans can access naloxone. Again, they can ask their VA provider. They can also call the pharmacy and ask for one. Our pharmacy team is constantly working to outreach veterans that are identified as at risk to offer it directly to them. And for any veterans who use My Healthy Vet, there's a triage group in there that all veterans should be in. That's called Opioid Overdose and Naloxone Education. That comes right to us. They can send a message and we'll respond right there. We are really working to be as accessible in as many ways as possible. And on the horizon, we actually have a plan to be able to text veterans about this initiative using the audio care platform to try and reach folks however is best for them to receive this information.
Yeah, that is great. Lots of different opportunities there. All right, we're coming up to August 31 and International Overdose Awareness Day. What are some of the activities VA Northern California has planned?
So we'll be having events next week at Mather, Martinez, Chico, and Redding campuses, and we'll also be participating in the resource fair that's occurring at Stockton next week. So we'll be tabling in the lobbies or other main areas at each of these campuses to be available to veterans right out in the open. We'll be offering overdose education, both with written resources, if that's their preference, but we'll also have a trivia game available to hopefully make that learning a bit more fun. For veterans that are then interested in receiving a naloxone rescue kit, we'll be collaborating with the outpatient pharmacy to get that filled for them to either pick up at the pharmacy while they're there, or if it's their preference, we could mail it to their house as well.
Yeah, that sounds great. All right, in a few months, we're going to have a prescription drug turn-in day here at VA Northern California. What are some ways veterans can turn in unused or expired prescription drugs?
So yes, we are so excited to participate in the DEA Drug Take Back Day in October. So this is something that happens every year, twice a year in April and October. And so as this event gets closer, we hope to share more specific information with everyone. But here at VA Northern California, we are lucky to have resources to dispose of medications all year round. We don't have to wait for these days. So at all 6 of our pharmacies, we have what are called MedSafe bins. These are metal bins that look kind of like a mailbox, and veterans can drop their unused, expired, or excess medications in that bin for them to be disposed of anytime that they're at the VA. If a veteran doesn't live near one of our campuses that has a pharmacy, or they don't have their medications with them that day, we can provide them with medication disposal envelopes. These are prepaid envelopes that the veteran would put those unused, expired, or excess medications right into it, and it's sent off for safe destruction. It's important for them to leave the substances in the original bottle so that when they're processed, they know what the medication is that they're disposing of. Over-the-counter medications are okay, prescription medications are okay, but they're not to be used to dispose of illicit substances. Some people will try to flush medications down the toilet, but for the majority of medications, it's actually not safe to do that. So if veterans or staff have a specific question about disposing of a certain type of medication, they can always contact their pharmacist for more information.
Yeah, that is great. So this has been a ton of information about the Overdose Awareness Day, about the drug take-back days. Anything else you wanted, while we have all the people watching on the video blog, anything else you'd like to share?
Yeah, so like I mentioned before, the resources that we are offering to veterans for harm reduction are not special or unique or restricted to just us. If I was the only person doing harm reduction work, the work would simply never get done. Any provider that supports a veteran in improving their health or well-being is helping to reduce the long-term effects of the issue that the veteran was up against and is therefore reducing their harm. They just might not have known that it could be called harm reduction. I like to compare substance use treatment to chronic disease management. For example, diabetes. If a patient hasn't yet made permanent changes to their diet, for example, we don't tell them, well, you haven't been able to stop drinking soda. You're clearly not ready for diabetes treatment. Come back when you're ready. We would never do that. Instead, we meet them where they're at that day, offer them support and resources that are safe and supportive for them at that time, and continue to be here to support them on their journey to better health. The same is true of substance use. Even if a veteran is not yet ready to stop using a substance altogether, if they're interested in improving their safety and reducing their risks, and we can keep the door open with us to support them, we want to be here. Because the support they want today is ultimately a step towards their recovery in the future that we want to be a part of.
Yeah, that is fantastic information. Carla, thank you so much for taking a few moments to share your wisdom, your knowledge, and education for our staff. So really appreciate your time today.
Thank you so much for having me here.